All right. Is it time? I'm not sure. Yeah, I guess.
Time for a nap.
Yeah.
I know that.
Okay. So we have the good therapeutic communication techniques, and we also have the opposite one. This includes the non-therapeutic or barrier communications. So this one doesn't allow patients to choose. They don't have options, they're not feeling empowered, they feel that they're being judged if you use this techniques of communication. The first one that we're going to tackle is about asking personal questions. If you're a patient and I ask you, ma'am, can you tell me your social security number? What's the last 4 digits of your credit card and all that? Do you think you'll trust me? No. If, for example, I'm being nosy, like, hey, how many relationships did you have? Like, what happened to your previous girlfriends? And then, how many miscarriages do you have, and who are the baby daddy? Do you think that you're very comfortable with that? Now, some nurses, particularly, they tend to be nosy. When they ask these questions, they end up being complained, and then the manager will tell them like, hey, you asked this question which is very personal to the patient. Okay. So always ask only relevant question which is focused on your assessment based from your nursing, based from the problem, or based from the nursing process. Okay. Don't ask questions just to satisfy your curiosity. Okay. Next, giving personal opinions. When you give your personal opinions, you take away the decision-making capacity of the patient. Remember that the problem and the solution belongs to the patient, not to you, not from you. Okay? If you say, if I were you, live him. If I were you, do this. Okay? If I were you, you have to vote for this guy. You're limiting the patient's capacity to choose. Okay? Do not give personal opinions. Also, you need to communicate to this special population. These are the patient that has hearing loss. So when you deal with patient with hearing loss, first check for any hearing aids that the patient is using, or are they using other hearing devices. Reduce the noise of the environment as much as possible. If you want to talk to someone, try to put them in a situation that you can actually, both of you can actually hear and without the distraction from the noise. Next is get the patient attention before speaking. Okay. So it happened to me one time that the patient was talking, I thought the patient was talking to me and I was replying, and actually the patient was talking to the person next to me, and then that was an awkward experience. Because like I was pretending that I know that person, but in my mind like I don't even know, like for the sake of replying, but like and she was saying, I wasn't talking to you, sir, and I was talking to that guy. Awkward. Okay, awkward. Face the patient, okay, with mouth visible. When you talk to especially older people who has like degrading hearing or hearing loss, please face them, okay? And then with your mouth visible, and do not exaggerate your lips. Hi sir, how are you? Because some people, especially if they have hearing loss, they will try to do lip reading. If you exaggerate your lips, they will not communicate to you effectively. Speak at a normal volume, do not shout. Okay, popular belief that if you have hearing problems, especially dealing with older people, you need to shout. No, that's a no-no. Do not shout. Okay, use a normal volume of your voice. Okay, and rephrase rather than repeat if misunderstood. The next special population are those who has vision loss, especially for those who has like stroke, older people who have cataracts. Okay. Check first if they're using glasses or contact lenses. Speak at the normal tone and voice. Always identify yourself when entering and exiting the room. Okay. Use proper lighting to avoid glare. Not lightning. Lighting to avoid lighting avoid glares, and if the patient has visual problems, and if you can communicate through the use of drawing boards, use drawing boards. Okay. Patient who has neurological condition, please use simple sentence and avoid long explanation. Say, for example, patient who has stroke. Now, it is a non-therapeutic communication technique if you ask close-ended questions. Say, for example, a yes or no. But people who has neurological conditions, like for example stroke, can benefit this communication technique. Say for example, are you hungry, sir? And then they will say yes or no. Because if you will going to ask them a lengthy question, for sure they will just start few sentences and they will stop. Especially if patient has expressive or receptive aphasia. And then allow patient time to respond. Do not interrupt. Do not flood them with questions. For sure they will misunderstood you. Use the attentive listening technique and always include the family in the conversation, but please be mindful who are you going to share the information with. Now I have activity here. An activity. Come on. What happened? Okay. Now instructions. Read a statement or set of statements and decide whether that is therapeutic communication or blocking communication. I have seven questions here. Okay, tell me if it's a blocking or therapeutic or non-therapeutic, and what particular therapeutic or non-therapeutic communication barrier did they use. All right, ready? Start with number 1. The client says, I keep thinking about my husband and how he is managing at home by himself. The nurse replied, you just have to put him out of your mind and concentrate on getting better. Question, therapeutic or non-therapeutic?
Non-therapeutic.
Or therapeutic and block. Because like when you say therapeutic and non-therapeutic, therapeutic. Yeah.
Block.
Therapeutic or block?
Block.
Very good. Okay. This is a block communication where the response does not acknowledge the patient's concern and you are giving a personal advice. Next. I don't know how I am going to cope with all the bills from being in the hospital. And you replied, I'll have a social worker stop by to go over with your insurance.
I feel like it's blocking because I feel like
All right, raise your hands if you think it is therapeutic. Okay, 1, 2, 3, 4. Okay, like 60%. How about is blocked? All right, the answer is blocked. Why? Because this is an advice. You're not supposed to give advice, but rather give an option. What are you supposed to tell your patient?
Would you like me to?
Would you like me to contact your social worker, or give them options and let them decide on their own? Okay? Remember, it's not about you, it's about the patient. All right. Next. I am such a burden on everybody since I had a stroke. What makes you say that? Says the nurse. Who says therapeutic? All right, very good. It's therapeutic. This is an open-ended question that encourages the client to explore his or her feelings. Client's daughter. I don't know how I am going to arrange care of my mother at home while I work. If it were me, I would put her in a nursing home where she should be around the clock care.
block. Blocking.
Who says block? Who says therapeutic? Okay, the answer is block. Again, this is giving advice. Next. I am afraid that I will forget how to correctly prepare the baby's formula when I get home. Would you like me to go over the procedure with you one more time?
Therapeutic.
Who says blocked? Who says therapeutic? Good. Okay, this is recognizing the mother's concern and the patient, the nurse does not dictate in this option. 6.
Block.
Who says therapeutic? Who says block? Good. Okay. What is this one? What type of block communication is this?
It's the general.
Generalization. Okay. Last. Who says therapeutic? Who says block? And what is this? What type of block communication is this?
Is that like opinion?
Giving judgment. All right. Very good.
You are very impressed.
Okay. Now, these are the NCLEX tips of communication. Now, communication is always part of your NCLEX in the near future. It's part of every like test item. Number one, self-awareness. Make sure that you're not biased, you're not imposing everything to your patient. Know your weakness and your strengths, especially in communication. Whatever is your biases or perceptual biases, leave them outside the door, and make sure that the hospital or the healthcare area is a neutral place. Focus on the patient, seek more information, listen, do not tell. Ask open-ended questions, and provide patient autonomy and correct information. Okay, those are the NCLEX tips. All right. Any question, guys, with the communication? All right, we'll proceed now with the next topic called documentation. The golden rule in documentation: if you didn't document, you didn't do it. Documentation is the vital aspect of the nursing practice. But to be honest with you, documentation, I think for most nurses is the least thing that they're going to do. Why?
Time consuming.
It's time consuming. Aside from that, what else? There are a lot of times that you need to what? To remember. Okay? But to be honest with you, documentation should be your best friend or your best defense.